Hi, I'm Stella Williams, a senior advocate and founder of Williams Senior Transition Services here in Austin. And for the past 3 years, I've helped families navigate the hardest decisions of their lives. And I became an advocate because I lived through these decisions myself with both of my parents. Welcome back to Navigating Senior Care with Stella. This is episode 7. Today, we're talking about skilled nursing facilities and end of life care. And I'll be honest, this is the hardest episode, even from the last one I shared about my mom. Because 5 years ago, on February 5th, 2020, my dad took his final breath in the hospital comfort care room. And to this day, I carry the weight of not being able to bring him home like he wanted. So today, I'm wearing two hats. You're a bilingual senior advocate who's available 24/7 when families are facing crisis placement decisions. And a daughter who lived through the impossible choice between what we want and what's medically possible. In the past 3 years, I've walked families through skilled nursing placement, hospice decisions, and the guilt that comes with it. Let's talk about skilled nursing, hospice care, and the guilt that comes when home isn't an option. First, let's clear up the confusion because nursing home and skilled nursing facility get used interchangeably, but they're not always the same thing. Skilled nursing facility, or SNFs, provide 24-hour medical care. We're talking about registered nurses on staff, physical therapy, occupational therapy, and speech therapy. This is medical care, not just assistance with daily living. SNFs serve different population. First, short-term rehabilitation after hospitalization. Let's say after a hip replacement. You might go to a SNF for a few weeks of physical therapy or stroke recovery. SNFs for speech and mobility therapy. This is usually covered by Medicare for up to 100 days if you qualify. Second is the long-term care for complex medical needs. We're talking about ventilators, feeding tubes, advanced wound care, dialysis, IV medications, needs that require nursing expertise beyond what home health can provide or what families can safely manage at home. Third is end of life care and hospice. And this is where my family story comes in. Before I share my dad's story, I want to remind you I'm Stella Williams, your senior advocate. This is episode 7, Skilled Nursing and End of Life Care When Home Isn't Possible. Thank you for being here and for trusting me with this difficult topic. Let me tell you what happened with my dad. My dad was diagnosed with lung cancer. For most of his journey, we cared for him at home. That's what he wanted, and that's what we wanted. We had home health nurses coming in. We managed his medications. We learned how to help him through the bad days and celebrate the good ones. And I was his medical power of attorney, which meant when decisions needed to be made about his care, they came to me. And at that time, I didn't realize how heavy that responsibility would become. He had just finished his radiation treatment and he was doing okay. Still trying to work in the yard, cutting branches, just being dad. But then the things changed. He developed fluid in his lungs. We had to get him to the hospital. They admitted him straight to the ICU. For a few days, he was in intensive care. They were draining 2 liters of fluid from his lungs. 2 liters, y'all. He didn't speak much. He was having issues breathing. And here's the part that still breaks my heart. He couldn't speak clearly, but he looked at me and asked if he can go home. And as his medical power of attorney, I was the one who had to tell him that because of his high oxygen needs, we couldn't get him home. I wasn't just his daughter in that moment, I was his POA, the person legally responsible for his medical decisions. And I had to say no to the one thing he wanted most. He just looked at me with his look that said everything. That take me home look. That I don't want to be here look. And I tried. God, I tried. I called every medical transport company in Austin. Every single one. I explained his condition, the oxygen requirements, the medical equipment he was on. I asked what it would take. I even begged some of them. No one would transport him. His oxygen requirements were just too high. The medical instability, it wasn't safe. They couldn't do it. And I had to stand there looking back at my dad who couldn't speak, knowing what that look meant and knowing I couldn't make it happen. As his POA, I was supposed to honor his wishes. But sometimes medical reality doesn't care about wishes. When it became clear he wasn't going to recover, they moved him from ICU to another room, a comfort care room. They started him on morphine for comfort, intravenous morphine, though there's also oral morphine that could be used depending on the patient's needs. And we had just enough time. I mean, at that time, we didn't know it was close to his last breath, but we had enough time to get my mom there, to get the family there. I felt like I had failed him, like I had broken the most important promise a daughter could make. But it was more than that. I was his medical power of attorney. I had signed the paperwork. I had promised to honor his wishes. And when he wanted to go home, I couldn't make it happen. That's a specific kind of guilt that comes with being a POA. You're not just family, you're the decision maker. And sometimes you have to make decisions that break your heart because medical reality doesn't care about promises. That feeling, if you're experiencing it right now with your parent or loved one, that crushing guilt of I should be able to bring them home, or if you're the POA and feeling like you're failing them, I want you to know I understand, not just professionally, personally. And when cure is no longer possible, care becomes about comfort, dignity, and quality of remaining time. This is where hospice comes in, and there are a lot of misconceptions about hospice that we need to clear up. Hospice is not giving up, hastening death, stopping all care, or just for only the final days. Hospice is pain management and symptom control, emotional and spiritual support, family counseling and grief support, dignity and comfort in remaining time, support that can happen at home or in a facility. Here's what most people don't know: hospice can be provided in multiple settings. It can be at home if the family can provide the hands on care with hospice nurses visiting, and in assisted living or memory care if the medical needs aren't too complex, in a skilled nursing facility when 24-hour medical support is needed, in a dedicated hospice house for the final days or weeks. The location doesn't determine the quality of care or love. Let me say that again. Where someone receives end of life care does not determine how much they're loved or how well they're cared for. When it became clear my dad wasn't going to recover, the hospital moved him from ICU to what they called a comfort care room. It wasn't ICU anymore. It wasn't about treatment. They made it softer, quieter. They brought in chairs so family could be with him. They stopped the constant monitoring. They stopped waking him for vitals every few hours. They started him on morphine, not to hasten death, to ease his breathing, to keep him comfortable, to take away any struggle. The focus shifted from treatment to presence, from extending life to honoring the life that was ending. We had just enough time to get my mom there, to get the family there. We surrounded him. We held his hand. We told stories. We told him it was okay to let go, that we would be okay, that we would take care of my mom. He opened his eyes for a bit. On February 5th, 2020, with all of us there, well, a lot of us there, he took his last breath. Here's what I learned from losing my dad in a hospital comfort care room. First, I didn't fail him. The medical system has limitations. Physics has limitations. No amount of love could overcome the fact that transporting him on high oxygen with a breathing tube wasn't safe. And being POA doesn't give you the power to change medical reality. I had to make peace with doing the best I could within impossible circumstances. That's what being a good POA actually means. Not granting every wish, but making the safest, most loving decision possible with the options you have. Second, The location of death doesn't determine the quality of death. My dad was surrounded by family. He wasn't in pain. He had dignity. He knew he was loved. That's what matters. Not the zip code, not the building, the love, the dignity, the presence. Third, skilled nursing facilities and hospitals serve a crucial purpose when medical needs exceed what can safely be done at home. When transporting someone would cause more harm than help. When 24-hour respiratory support or complex wound care or IV medications are needed. Medical facilities fill that gap. Fourth, you can advocate even in a facility. Even as this POA, I didn't have control over everything, but I had control over some things. We didn't just accept whatever they offered, we asked for what he needed. Being POA doesn't mean you can change medical reality, but it does mean you can advocate for dignity, comfort, and family presence. You can ask questions, you can push back when something doesn't feel right, you can make sure your loved one is treated with respect. That's the power you do have. And finally, grief doesn't care about where someone died. It cares about the fact that they are gone. Whether they die at home or in a facility, the loss is the same. The love is the same. As a senior advocate who evaluates these situations every week, families ask me this all the time. How do I know if skilled nursing is the right choice? And often they're asking as a POA, the person who has to actually make that decision. In my 3 years helping families, I've learned that skilled nursing becomes necessary in specific situations. Medical needs that require 24-hour nursing, ventilator dependency, complex wound care, that includes stage 3 or 4 pressure ulcers, IV medications or TPN, which is nutrition through IV, frequent aspiration requiring suctioning, dialysis with complications, high oxygen needs with unstable vitals. Safety issues that can't be managed at home. Severe fall risk requiring constant supervision and medical monitoring. Behaviors that endanger the caregiver or patient. Medical equipment needs that exceed home capabilities. Need for multiple skilled interventions daily. Rehabilitation needs. Post stroke recovery. Post surgery rehabilitation. Learning to walk again after a major medical event. Regaining strength and independence. End of life care when home isn't possible. Complex symptom management. Family unable to provide hands on care. Medical equipment needs. Patient safety concerns. If you're considering skilled nursing for your loved one, here are the critical questions to ask. About staffing, what's the nurse to patient ratio? Are there RNs on staff 24/7 or just LPNs at night? What's the staff turnover like? About care, how do you handle pain management? What does your hospice partnership look like? Can family visit anytime, even overnight? How do you communicate with family about changes? About quality, can I see your most recent state inspection report? What's your hospital readmission rate? How do you handle complaints? Can I speak with families of current residents? About the end of life, if applicable. Do you have comfort care rooms? How do you support families during the final days? What happens after death? This matters. And if this feels overwhelming, if you're looking at a list like this and thinking, I don't even know where to start, that's exactly why I offer free consultations. I've toured these facilities. I know which questions matters most, and I'm bilingual, so if your parent is more comfortable speaking Spanish, I can help with that too. And if you're the POA, I understand the weight of that responsibility because I've sat in that chair too. 5 years later, I can tell you that the guilt has softened, not disappeared. I don't think it ever fully disappears when you can't fulfill a loved one's final wish. But I've made peace with the fact that I did everything humanly possible. And sometimes everything humanly possible still doesn't look like what we want it to look like. And that experience, that impossible situation with my dad, combined with everything I went through with my mom, that's why I became a senior advocate. So that when families call me at 2 a.m. because their parent just fell and the hospital is saying they can't go home, I can say, I know, I've been there, and I'm going to help you figure this out, especially if you're the POA, if you're the one who has to sign the papers and make the calls. I've been you. I understand that weight. If you're facing a decision about skilled nursing for your loved one, here's what I want you to know. You're not failing them. You're responding to medical reality. You're making the best decision you can with the circumstances you have. Love isn't measured by location, it's measured by presence, by advocacy, by honoring their dignity, by making sure they're not in pain. You can do all of that in a skilled nursing facility. I promise you can. And if you need help finding the right facility, understanding what questions to ask, or just someone to talk to who's been through this, I'm here. Williams Senior Transition Services offers free consultations because I believe no family should navigate this alone. In the next episode, we are diving into memory care explained, when specialized dementia support is needed. We'll talk about the difference between assisted living and memory care, how to know when it's time for that transition, and what to look for in a quality memory care community. But if you're in that space right now, dealing with the guilt about placement, struggling with, I should be able to bring them home, I hope today's episode helped. Until then, be gentle with yourself. You're doing the best you can. And sometimes the most loving thing we can do is accept the limits of what's possible and find peace within those boundaries. I'm Stella O'Hara Williams. Thank you for letting me share my story with you. If you need help navigating skilled nursing or any senior care decisions in Austin, I'm available 24/7. You can visit my website at stellawilliamstx.com to learn more about Williams Senior Transition Services, or browse Austin's senior living communities with photos and virtual tours at tourseniorliving.org. You can call me directly at 737-389-2130. I'm bilingual, so if you or your parent are more comfortable speaking Spanish, we can do that. Take care of yourself out there. You matter too.